Hi all, welcome to OET Speaking and Writing. Today we can discuss how to inject insulin with insulin pen. Before proceeding with the injection, you need to make sure your hands are clean. So wash your hands before you start. Wash your hands with soap and water. See, this is the insulin pen. First you need to remove the lid of the pen. After that, put a new needle on the pen device. In order to do this, take the needle and peel back the cover of the needle. Screw the cap on the pen and take out the white outer cover. After that, take out the green inner cover to expose the needle. Every time when you inject yourself, you will need a new needle. Now look at the pen. There you can see a dose window with numbers on it. Initially dial up 2 units and push the plunger until you can see the insulin coming out at the end of the needle. To make sure there is no air bubble, this is called air shot. After that, you can dial the desired number of units you are going to give by rotating the end part of the insulin pen. Then you can decide the site. There are several areas of the body where we can inject the insulin. These are outer aspect of arm, thighs and 2 inches away from the belly button. Always make sure that you set the right dose of injection before giving. With the left hand, you can pinch the skin. With the other hand, hold the pen and push down the needle straight to the skin. Now you can move your thumb to the end of the pen and push the plunger down. Then you can inject slowly and remain the needle until you count up to 10. After that, take the needle away from the skin. Finally, you can remove the needle from the pen and put it in a sharp box. There are some key points that we need to keep in your mind that before proceeding with the injection, we need to make sure hands are clean. So wash your hands with soap and water. Another important thing is sides get rotated. That means injection can be given in different sides and should always be rotated injection sides. If you do not rotate, your skin may become lumpy and the insulin will not get properly absorbed. Always inject at 90-degree angle and keep the needle in for 10 seconds after injecting to allow the insulin to move away from the puncture site. Insulin pen can be kept at room temperature. Insulin pen can be kept at room temperature for 1 month. Spare insulin needs to be stored in the fridge. Next, we can discuss about inhaler with spacer. Here I am going to show how to use an inhaler with spacer. This is the inhaler. First, hold your inhaler upright and take the cap off. Please check there is nothing inside the mouthpiece. Then you can shake it well. Then take the spacer. This is the spacer. If it has a cap, please take it off. And put your inhaler into the hole of the spacer. Then you can sit Now you can sit straight and slightly tilt your chin up as this helps the medicine reach your lungs. And the next step will be like this. Breathe out gently and slowly away from the inhaler and put your lips around the mouthpiece of the inhaler to make a tight seal. Then you can press the canister of the inhaler which is at the upper part and continue to breathe in slowly. Take the mouthpiece of the spacer out of your mouth and close your lips and hold the breath up to 10 seconds. After that, you can breathe out gently. And there are 2 types of inhalers are there. First one is reliever inhaler and the second one is preventer inhaler. And the reliever inhalers are to reduce the symptoms when they occur. These are to relieve the symptoms when they occur. And the preventer inhaler are to stop the symptoms developing. These are the 2 types of inhaler. In order to use the inhaler, first we need to hold the inhaler upright and take the cap off and check there is nothing inside the mouthpiece. After that, you can shake it well. The next step will be take the spacer, put the inhaler into the hole of the spacer. Then you can sit or stand up straight and slightly tilt your chin up. Breathe out gently and slowly away from the inhaler and put your lips around the mouthpiece of the spacer to make a tight seal. Press the canister of the inhaler which is at the upper part and continue to breathe in slowly. Take the mouthpiece of the inhaler out of your mouth and close your lips and hold the breath up to 10 seconds. After that, you can breathe out gently. Now we can discuss how to use a spirometry. Spirometry is a simple test used to help diagnose and monitor certain lung condition by measuring how much air you can breathe out in a forced breath. It's carried out using a device which is called spirometer, and it's a small machine attached by a cable to a mouthpiece. Now we can discuss how to use a spirometer. You will be seated during the test and a soft clip will be placed on your nose to stop air escaping from it. Then you need to inhale fully so your lungs are completely filled with air. Close your lips tightly around the mouthpiece. Then you can exhale as quickly and forcefully as you can. And this will be repeated at least 3 times to ensure a reliable result. In the spirometry procedure, we need to sit in a comfortable position and a soft clip will be placed on your nose to stop air escaping from it. First, you need to inhale fully so your lungs are completely filled with air and close your lips tightly around the mouthpiece. Then you can exhale as quickly and forcefully as you can. This will be repeated 3 times to ensure a reliable result. The next one is Peakflow test. This is a simple measurement of how quickly you can blow air out of your lungs, and it's also helped to diagnose and monitor asthma. It involves blowing out air as hard as you can into a small handheld device which is called as Peakflow meter. Now we can discuss how to use a Peakflow meter. Firstly, sit in a comfortable position. Then take the Peakflow meter and reset the pointer to 60. You can simply push back the pointer to the first line of the scale, which is usually at 60, and hold the Peakflow meter horizontally. Breathe in or inhale as deeply as you can and place your lip tightly around the mouthpiece. Then you can breathe out as quickly and hard as you can. When you have finished, breathe out. Make a note of your reading. This should be repeated 3 times and the highest point and the highest of these 3 measurements should be recorded as a flow reading. Here we need to sit in a comfortable position. Take the Peakflow meter and reset the pointer to 60 by pushing back the pointer to the first line of the scale, usually at 60. Then you can hold the Peakflow meter horizontally. Breathe in as deeply as you can and place your lip around the mouthpiece. Breathe out as quickly and hard as you can. When you have finished breathing out, make a note of your reading. And this should be repeated 3 times and the highest point of these 3 measurements should be recorded as your Peakflow value.